Hi, my name's Rayanne Berkey, and today I'm going to be talking to you about ankle impingement syndrome. This syndrome is defined as a painful limitation of full ankle range of motion secondary to an osseous or soft tissue abnormality. Ankle impingement is a chronic injury secondary to an acute traumatic injury such as an ankle sprain. After an ankle sprain, 20 to 40% of patients have chronic ankle pain. Of those patients, approximately 1/3 have pain related to impingement. Ankle impingement is commonly referred to as footballer's ankle due to its prevalence in soccer players. However, it happens frequently with dancers as well. There are 4 types of ankle impingement. These include anterior, posterior, anterolateral, and syndesmosis impingement. For our purposes, we will discuss posterior and anterior ankle impingement because they are the 2 most common types of ankle impingement seen in dancers. Posterior ankle impingement is usually located posteriorly or posterolaterally following an ankle sprain. However, in the case of dancers, posterior impingement can develop over time due to prolonged periods of time spent in extreme plantar flexion. Anterior ankle impingement presents itself as a persistent pain or disability after an ankle sprain. This pain will be felt as stiffness or blocking of dorsiflexion. For dancers, this means pain will appear most often during pliés and jumps. The leading cause of ankle impingement syndrome is overuse. As defined by the American Orthopedic Society for Sports Medicine, an overuse injury is the result of repetitive microtrauma to the tendons, bones, and joints. Factors that contribute to overuse injuries include improper technique, imbalance between strength and flexibility, improper equipment, poor core stability, and poor proprioception. While it is important to be aware of those contributing factors, there are other causes of ankle impingement. These include, but are not limited to, results of recurrent ankle sprains, activities that require repeated plantar or dorsiflexion, bony anomalies, muscle tightness, and excessive training. Keeping those causes of ankle impingement in mind, there are several prevention strategies for us to take into account. First, it is very important to practice proper technique. The forcing of a turnout in a plié can result in anterior impingement. Posterior impingement can be heightened by not landing with the heels all the way on the ground following a jump. Along with practicing proper technique, it is imperative to use proper equipment. For dancers, this means finding the right shoe, be it point, jazz, or tap, in order to allow for a full range of motion. Another very important prevention strategy that isn't often mentioned is to maintain a healthy diet. Ankle impingement can be amplified by too much weight on the area. In the event that these preventative measures don't work, the initial first aid treatment follows the RICE acronym. It is important for the dancer to rest by cutting back on the frequency, duration, and intensity of whatever movement provokes the ankle pain. Ice, compression, and elevation help to reduce any swelling that may have occurred. Much like many other injuries, icing should occur at first notice of pain for 20 minutes every 2 hours for at least 36 hours. It is also recommended that anti-inflammatory drugs be taken to help reduce swelling and pain. For serious ankle impingement pain, treatments include steroid shots or, in some cases, arthroscopic surgery to remove the offending bone or soft tissue. Following treatment, it is important to create a rehabilitation program. Within your rehabilitation program, it is essential to start with regaining the full range of motion of the ankle. From there, you will wish to restore muscle strength by doing calf, ankle, and foot exercises, beginning with non-weight-bearing and slowly moving to weight-bearing exercises. Non-weight-bearing exercises can include TheraBand exercises or simply providing traction to your ankle with your hands while pointing and flexing the foot. Weight-bearing exercises may include releves or plies, focusing on proper technique. After this, the dancer can begin to restore high speed, power, proprioception, and agility by slowly easing into more difficult exercises such as weightlifting or jumping. From there, the dancer will be able to return to normal daily function and sport activities. While putting together these exercises for rehabilitation, remember to follow the 10% rule. This means don't increase your workout regime more than 10% each week. Also, be sure to consult with your doctor or physical therapist to verify